I'm Amy Mante. I'm Deputy Director for the Department of Planning and the Master Plan Coordinator. I'm very excited to see that we have a large number of Baltimore County agency representatives here tonight from the library, police department, rec and parks, health and human services, the Office of Community Engagement, environmental protection, and aging. At least those are the ones I captured very quickly there, so hopefully I haven't missed anyone. And we do have some of our planning board members present. So we're very glad that everyone could join us tonight. Before I get started, I'd like to introduce Steve Lafferty, our Director for the Department of Planning. And I believe he has a few words he'd like to say.
Thank you very much, Amy, and thank you to all the agency representatives who have joined us tonight. But more importantly, thank you to the Baltimore County community at large and all of you who have decided to weigh in on another one of these important elements of the county's master plan. The planning process really started with a lot of community engagement well over about a year ago, and we've learned a lot and hopefully been good listeners and have taken into account the concerns the community has presented to us. And in this phase two that Amy and others will lay out for you tonight, there's another opportunity to really weigh in on what the goals and actions should be to lead us over the next decade. So your involvement tonight and your participation is critical. And once again, we're very pleased to see so many people coming and weighing in so that this plan does reflect the needs and wants of the Baltimore County community. So once again, thank you very much for spending some time with us tonight and sharing your thoughts and input. Thank you, Amy.
Sure. All right, we'll go ahead and get started. Welcome to the 5th in our series of 7 meetings we're holding in January and February. Tonight, we'll give you a brief overview of the input we gathered in phase 1, and then present our draft goals for a healthy community. And then after that, we'll ask you for your input on those goals. So as I mentioned, we're hard at work at Master Plan 2030 through the summer and fall of 2021. The Department of Planning conducted a series of community engagement meetings that we know many of you attended. They were held in different communities throughout the county, and the input that was gathered will guide the vision for the county over the next 10 years. We held 50 community engagement meetings. Over the course of those meetings, we engaged with over 1,000 citizens and captured about 4,000 comments related to where people see their communities and the county evolving over the next 10 years. The meetings were held across all 7 council districts and engaged over 35 various community groups. We asked broad questions about what you valued most or what you wanted to see changed in your communities. We also asked where you see the county in the next 10 years. From the input we gathered, the top 3 most discussed categories were land use, economic development, and transportation. Most notably, the most engaged groups were located in the western part of the county, Catonsville, Randallstown, and Woodlawn. Also interesting to note, residents expressed the most support for walkability and pedestrian-oriented infrastructure, streetscape improvements, renovated schools and parks, green space and parks, redeveloping aging commercial corridors, senior housing, stormwater, small businesses and local businesses, community engagement, and participatory planning. And of most concern were school overcrowding, traffic and congestion, overdevelopment, loss of green space, the continued threat of climate change, lack of professional and recreational opportunities for young people, and blight in older communities. Now, as we're moving to phase 2, we're doing work internally, not only to review everything that we heard from the community the past few months, but also review existing conditions and emerging trends to determine the big ideas for moving the county forward to where we want to be by 2030. At the heart of this process is the idea that local government should invest more and more thoughtfully in its people and infrastructure. Using what we heard in the summer and fall, we've developed draft goals for 6 master plan topics. The goals are grouped into 6 categories: livable built environment, resilient economy, interwoven equity, healthy communities, harmony with nature, responsible regionalism. Each of these groups is led by a community planner with staff support from within the department. So very briefly, before we discuss healthy community tonight, I want to provide a quick overview of all the input we gathered this summer and fall. For livable built environment, we heard a lot about trash collection and recycling, code enforcement needs, continued maintenance of public facilities. For housing, we heard about a need for affordable senior housing throughout the county and support for a variety of housing types. There's a strong emphasis on stormwater and sewer, road paving, as well as expanding high-speed internet in the rural areas. We also heard a lot of concerns about traffic and congestion, as well as suggestions for improvements to specific intersections and pedestrian access and walkability. We also heard about a need to reform the comprehensive zoning map process and enforce the urban-rural demarcation line, as well as concerns about the need for more transparency in the development process, including possible updates to the plan unit development process and updates to zoning regulations. For a resilient economy, we heard about improving and diversifying retail options in commercial centers and redeveloping large shopping mall properties that may now be vacant or partially vacant. Retrofitting retail corridors to change the focus from auto-centric to more friendly to pedestrians and to the neighborhoods that are surrounding them. Adaptive reuse for vacant or obsolete properties, as well as grant programs for facade and streetscape improvement. The county needs to be able to attract large-scale job creators and emerging industries without forgetting about those small businesses and local businesses. The opportunity to support agritourism in the rural part of the county, and workforce development that needs to be able to meet the needs of emerging industries in the future. For interwoven equity, we heard about the need to address underserved and vulnerable populations to ensure fairness and equity in housing, services, health, safety. We heard about the need to expand public venues and performance gathering spaces that could be used to build up communities and express cultural diversity. We also heard about community coordination, the need that residents want to know that their communities are being maintained and they're getting services from the county they can interact with, partnerships between local institutions and community groups, and a more accessible internet presence on behalf of the county with more newsletters, more of maybe an interactive dashboard where residents could maybe more readily access government news, updates, and those types of things. And of course, we heard about the history of the county and historic preservation and the need to preserve the county's heritage and how that plays into economic development. For healthy community, we heard about public health, focused on the health and wellness of two specific groups, senior citizens and young people, to ensure that communities remain walkable, accessible, and with resources that allow for aging in place and recreational opportunities. For public safety, a lot of what we heard was really related to the communities that we were talking about or who we were talking to. Lots of discussion about less crime in that specific area, or more public safety, or better communication with the police department. There was a desire for a focus on pedestrian safety and reducing speeds and using traffic calming measures more broadly in the county. Also, police presence and how that's related to greater enforcement and lower crime rates. And Randallstown had some pretty serious concerns about sex trafficking in their area. In harmony with nature, we of course heard about Baltimore County's waterfront. The shoreline should be publicly accessible and safe from flooding and erosion. Reforestation, tree preservation, tree canopy were all looked at as value-added investments to the community. Plan for impacts to infrastructure, health, and environment in response to climate change was also a very prominent topic. Related to recreation, parks, and open space, there was a universal consensus that residents overwhelmingly expressed a desire for improvements to the quantity and quality of parks in the county, And they want to see more opportunities for walkability, bikeability, parks, ball fields, greenways, conservation easements, all those things that maintain connection to the natural world. And for responsible regionalism, there were a lot of comments and interest in the connection between the county and nearby communities, not just you know, in a smaller scale, but also looking at surrounding counties and where we fit within the Washington, D.C. region, the success and failures of the city, and how those may or may not impact the county were also of concern, but also a desire to work together to find solutions to issues that may affect the region. So as I mentioned earlier, tonight is the 5th of 7 meetings where we're asking for your input on our draft goals and for your help in the development of actions to implement these goals. At this point, I'll turn the meeting over to Ganejo, who is the staff lead for the Healthy Community Work Group.
Thank you, Amy. Good evening, everyone. My name is Ganejo, and I'm the lead staff for the Healthy Community Work Group. So our objective for the healthy community is to ensure that public health needs are recognized and addressed through provisions for healthy foods, physical activity, access to recreation, healthcare, environmental justice, and safe neighborhoods. So based on input from the community engagement meetings this summer, adopted community plans, best practices, and also input from other county agencies, we have developed the following draft goals. Goal number 1 is to attain full health and well-being for all ages and communities by eliminating health disparities and promoting healthy development and behaviors. Goal number 2, using a multi-agency approach, foster safe and stable communities and address public safety issues that affect all residents. Goal number 3, provide quality public services for citizens of all ages in all communities, regardless of income or ability. And goal number 4, provide and promote safe, equitable, and inclusive access to quality parks, green space, recreation facilities, and programs. So we'll now break out into groups to discuss these goals and actions that are associated with the goals in greater details. The action will be shared when you are in the breakout rooms. The goals are supporting actions are presented in no particular order. So we just want you to let us know if you generally agree with the direction of the goals and the supporting actions, and if there are any additional actions that you should be added. You will be having a moderator assigned to your breakout room. So the moderator will be leading you to the discussion. And at the end of the session, we will be meeting back in the lobby. So we have 1 hour set aside for this exercise, but you can come back to the lobby if you finish early. So when you move to your breakout room, you may delay a computer audio. So if that happens, you have to follow these instructions. Just click on connect to reconnect your computer audio. So at this time, Emily will now break us into groups. Okay, is that everybody staying in the lobby with me? Seems like people are starting to join their work group. Can you all hear me?
Yes, I can hear you.
Okay, so looks like you are stuck with me for the next hour. Let me share my screen so you can see, where is it again? Give me a second, please. Yep. Can you all see my screen? Do you want me to expand it?
You can make it a little
If you can make it a little bit bigger.
All right, I
That's
think this is as big.
Oh, no, that's good.
This is good? Okay, good. So again, we have 1 hour for this exercise. We have 4 goals. The goal is to go to all the goals and to the actions. So we're gonna review everything. I'm gonna go with the first goal. I'm gonna read the actions, and at the end of the action, you can tell me, give me your input. I will type it as fast as I can. So goal number 1 for community health is to, let me get rid of this. So the goal again is to attain full health and well-being for all ages and communities by eliminating health disparities and promoting healthy development and behaviors. So the actions to support this goal, action number 1, ensure our built and natural environments are clean, green, and sustainable, so residents will enjoy the physical beauty of Baltimore County and experience positive health impacts natural resources can provide. Number 2, increase efforts, including public health education, to prevent, reduce, and treat substance abuse, including narcotic drug use and harmful use of alcohol. Action number 3, promote mental health awareness and well-being for all ages and provide resources so that residents can obtain mental health services. Establish a crisis stabilization center for ER diversion for intake related to behavior and mental health. Number 4, develop a suicide prevention plan with initial focus on youth to reduce suicide rates. Number 5, formulate an action plan to reduce the number of individuals becoming homeless for the first time and individuals returning to emergency shelter by 60% in 10 years. Number 6, provide adequate resources for senior citizens to age in place comfortably by improving resources to stay in their homes, improving existing ADA accommodation, and offering necessary resources. Action number 7, reduce the number of food deserts and promote access to healthy food for all ages, particularly in low, moderate income communities. Number 8, adopt health in all policies initiatives by incorporating health factors into decision-making across sectors and policy areas. Number 9, promote workforce diversity, including multilingual healthcare workers to strengthen access to equitable healthcare. And number 10, enhance the quantity and quality of healthcare options in medically underserved areas throughout the county. Do you generally agree with the goal? You can unmute and let's, and join in the discussion.
Yeah, I think we generally agree. They're all pretty intense.
The goal is intense or the actions?
Well, the goal to attain full health at all is something to agree on. The actions are all pretty intense.
All right, so let's go to the actions now. Do you generally agree with the actions? Do you disagree? Is there anything that you would like to add? Is there any action that you would like to discuss more in details?
Can you go through them one by one and let us discuss?
Well, we have again 15 minutes for this part of this goal.
Yeah.
We can do that, but I'm afraid that we may not be able to cover everything. So which one would you like to discuss?
So my comment would be that these are all things like mother and apple pie. How can you disagree with them? It's a question of how we do it and how, how committed we are to fund these efforts appropriately. Mental health is certainly something that we know is needed, and having first responders that are mental health professionals is probably the one thing that many people agree is something that's needed. The food desert issue, perhaps we could do things like make sure that underserved communities have spaces where they can where they can grow their own vegetables, and that there are resources to help them learn how to do that. But, you know, there really is nothing to disagree with in this list of things. It's just,
Right.
you know, how you prioritize and how you actually make them happen.
I'd like to also add on to that. I agree with that comment. I think number 10, which talks about quantity and quality of healthcare options in medically underserved areas, to me almost seems like the most important. And I'm not sure whether the way it's written is about, are there enough, doctors or hospitals in the vicinity, or maybe the issue really is there adequate health care available to the residents, in the sense of, do they have a health care program that they're subscribed to and that they can get assistance with? It's a lot easier to deal with building health if you have outreach to people before they get to a crisis stage. Trying to provide crisis level services is really difficult. And I'm not sure how much of that challenge is related to public health as opposed to, economic development. Do people have jobs that are going to give them access to health care or the
I would add to
resources
what
to be able to
Marcia's
pay?
saying. I would add to what Marcia's saying that one of the big issues is access. And by access, I mean, is it along some traffic hub? Is it on a bus line? Is there walkable ways to get to wherever it is? Can you get there from here? Is there a sidewalk? There seems to be a great amount of difficulty, a lot of focus in these meetings about traffic hubs, but there doesn't seem to be focus on where they get you. Do they get you to the food desert? Do they get you to the health care? Do they get you to these places that we're focused on?
And can they afford it once they get there?
And what was that?
This is
Can they afford the service once they get there? I
so.
think that's a big problem.
This is Laura Culbertson from the Health Department. The term medically underserved areas refers to the fact that there's no doctors or health centers in these areas. So that's what it's meant to say. Maybe it should be reworded a little bit.
Okay, I'm sorry, Laura, say that again, please. So you were saying that the underserved areas meant what?
The MUA, that term, medically underserved area, means there's no doctor or health center in that specific area. And it's a survey that's done by the Maryland Department of Health. So that's what it means. It means that even if you had a sidewalk or a transportation or could afford it, there's no doctor in your area to go to. You have to go up to MedStar Franklin Square. You have to go to Sinai. You can't stay in your area because you don't have a practitioner there.
So it's
So
physical
instead
access
of
as opposed to
quantity and
financial.
quality,
Well,
instead of quantity and quality, you're saying availability, really.
Yeah.
Yeah.
That's what that means. Yes. That's what
And
it.
what about
should mean.
affordability? Are there any programs in the county for people who are
In need of,
otherwise unable to get health care? They have no programs, or they can't afford to.
Yeah, that would be federally qualified health centers who provide that service. In the medically underserved areas, there's no transportation to the ones that are available, the FQHCs. So that feeds into that medically underserved also. So, of course, I'm very happy that you picked that one to talk about.
And I'm happy you're here to help me with it. Any other actions you would like to discuss? I know in here you said 10 is the most important action in here, but what about the other ones?
Well, the senior citizens living in place seems to be an increasingly popular and affordable option. But I think we need to focus on that, and as well as making sure that where they are currently living is up to a standard that helps them maintain a healthy existence.
Somebody raised their hand. I missed that.
Hi, this is Jennifer. Now, this was adding on to 10, and I put it in the chat, and Laura would probably have more information to provide on this, but also tapping into sort of, there's a lot of healthcare management programs that exist with current insurers, and whether or not, I don't know, if the state, county, state, things like that can collaborate with those groups. But, looking at preventative medicine type of programs, and also, programs similar to the VA's MOVE program, which promotes physical activity.
Okay.
The only other thing would be environmental health, which you mentioned earlier. Parks, open spaces, green,
Air quality.
air quality, that provide air quality, but also a place to be with clean air and clean facilities
For exercise.
for exercise, for just the experience of being in a healthy, open, green place.
And we'll discuss that further when we talk about the community recreation and parks. Good to see you, John.
Okay, yes, you too.
All right. Do you guys want to move to the next goal, or you still want to add some more feedback to this one?
Next goal.
Okay, great. Next goal is on community safety. The goal is using a multi-agency approach, foster safe and stable communities, and address public safety issues that affect all residents. Do you generally agree with this one?
Yes.
Thank you. The actions to support this goal: number one, reduce criminal activity, including violent and organized crime, through effective communication, education, partnership, and cooperation on a local and regional basis to create safe communities for all. Number two, provide early intervention initiatives to reduce the number of crimes committed by juveniles and reduce the influence and recruitment efforts of gangs. Number three, decrease recidivism in juveniles and adults by providing educational programs during incarceration and equipping inmates with information and resources when they return to the community. Number four, adopt Vision Zero strategy to facilitate safer streets for all users, including cyclists and pedestrians, to reduce traffic-related deaths and injuries to zero fatalities. Number five, enhance and expand training opportunities for Baltimore County Police Department to ensure best practices and legislative changes and updates are incorporated. Number six, Jennifer, you raised your hand. Do you want me to stop right now and let you ask your question, or after?
Continue.
Okay, thank you. Number six, construct a joint police and fire training facility that includes facilities for the agency's Special Operation Division. Number seven, improve police force recruitment and retention to increase the number of active duty officers. Number eight, modernize and update the police and fire department aging facilities and vehicles and outdated technology. So with these actions, is there any terms that you don't understand? Is there any action you would like me to better explain? Do you generally agree with the goals, disagree? Is there any other actions you would like to add?
Generally, these are all maintenance actions, things that should have been going on and should continue to be going on. The only other thing I would put more emphasis on, we talked about in the economic section, which was find more training programs for technical jobs, not just computer stuff, but automotive training, other kinds of programs that people can actually go and get a job and earn money from.
Yeah, I'm not sure if you attended our resilient economy, but we
Yeah,
talked
we
a lot
talked about that.
Yeah.
But in terms of crime prevention, I think it's extremely important.
I agree with John, and that's what I was gonna indicate. Like the fact there shouldn't be a list of crime prevention if you're not including employment
There
opportunities.
should be. I'm sorry, Jennifer, could you say that again?
I'm just indicating there shouldn't be a conversation about crime prevention unless you're including employment opportunities, because that's sort of what leads to, alternative ways to have income
And
Okay.
training.
and
fr-
training. Yes, sir.
Accessible, free training for the jobs.
Can I ask a question? These are all important things. The problem is there's never enough resources, both staff and dollars, to do everything everywhere. From a prioritization standpoint, I think it would be very helpful if it would be clear in this section, are some of these higher priority to do short term and some are midterm and long term? Or are all of these important, but then you would try and target certain specific areas? Because you can't accomplish all of these goals across the entire county at one time. So I guess I'm just trying to understand what
Yeah.
would be the short-term, midterm, and long-term priorities.
So you're right that we cannot tackle everything at the same time. Once we finish this phase, of drafting the actions and the goals, and we finalize them, we're gonna have to come up with a way of prioritizing these into a short, medium, and long term, and
Okay,
start,
good.
implementing and yeah, and okay.
So in the section where we're talking about increasing police and retaining police, we shouldn't ignore the fire department. They're in an equally bad situation, particularly as it comes to EMS.
Okay, and that was goal number. Are you talking about the facilities? You're not talking about that, but
What facilities?
enhance the training of the Baltimore County Police.
No, it says something in number 7.
Number 7, police. Okay, so we should also include fire department.
Yes.
Yeah,
Particularly with EMS. EMS seems to be really a bad problem these days. And some of the other policies that the fire department has instituted, and I'm not against the policies. I agree with their policies, but they're requiring more and more trucks to respond in lieu of EMS or along with EMS. That's really taking a burden on the rest of the system.
Yeah, I'm making a lot of mistakes when with typing, trying to type fast, but I'll clean everything later on. I'm just trying to make sure that I get your ideas. All right, anything else?
This is Jennifer again. When you scroll up on that talked about sort of, let's see, where is it at? On number 3, equipping inmates with information and resources. You don't have to add it now, but just some specificity to what resources mean. Just ensuring that that's, spelled out, and that there's some sort of coordination with, are those, if they're jobs, and there's a list of companies or manufacturers, whoever, that the county would be working with to ensure job resources are made available to those that are returning to the community.
Yeah, this is Laura again. Examples of that would be access to insurance before they leave and things like that.
Thank you, Laura.
I'd also like to see some sort of comment about education with a direction towards juveniles, to try and keep them out of the system. It would be better to be able to push education earlier on and not be trying to do it after they're already in trouble and arrested.
like in high school or in middle school even.
Yes, both of those.
Yeah.
Okay.
That's a really important point. I think we assume in schools that everybody needs to have, algebra 1 and algebra 2 and move on to trigonometry. That's great for a lot of kids, but it isn't necessary. And the trade schools and the programs that would get a lot of young people ready to get a job right after finishing high school is really, I think, something that, has gotten a lot of, discussion, but not much action.
Yeah. Everybody should learn a trade, and then going beyond that is up to them, but they need to have some way of supporting themselves.
I would also add housing to the decreasing the recidivism for released people that have served their time.
Yeah, there was a judge somewhere that made the case that once they have served their time, the punishment should end. It shouldn't continue on. And so there should be probably legislation that says, you can't reject somebody because of something they did once.
Or need help.
So
paying.
can you elaborate on this housing thing? Do you want the housing to be free? Do you want some type of concentration where, they,
The,
can
the
you
house,
elaborate?
the housing could be paired with job provisions for released people so that they would, in turn be able to, support their housing. I mean, they come out and they don't have housing or jobs. So what are their alternatives?
Okay, I got it.
Yeah.
Hi, Kathy. Good to see you too.
You too, Gane. Thank you.
You're welcome. Mary, yes. Hi, Mary.
Hi. I was just looking at the education towards juveniles before and not after being in trouble. Doesn't that fall under, I think it was like 3 or 4. I have to go back and look because on your screen, we only have the thing. No, to provide early intervention. I guess early intervention to me is like education and that
Yeah,
type
you're
of
right.
thing to reduce
You're
the
right.
number of crimes.
That will include, yeah.
Yeah, that fits in. And I guess the other comment I wanted to make is just kind of an overall comment for all of these. I've been sitting on all of the meetings the last 2 weeks, and so many of these goals cross over. So, and I'm thinking of just like the zero vision with the bicycle lanes. And I mean, that a lot of that discussion came up under another. Will they all be kind of merged? So instead of it looking like we have 100 goals, it would be decreased to bring things together that are all the same things in the long run for the plan?
Yeah, so we did see that there was a lot of overlapping between, different groups. And we're gonna have to do that exercise. Yes, you're right. We're gonna have to do that exercise and see what action fit better in what group, and then move it to that group. You know what I mean? So yeah, that exercise will be done later. I think again, this is like the first phase of going to the draft goals and actions and just trying to get feedback from you all. There's a lot of things that we have to do after these engagement meetings. Clean up the actions, make sure that we add your input to it, and so on and so forth. Yes.
It just seems because it's kind of like overwhelming all these things, and you're really looking pie in the sky if you think.
I know. Yeah.
Okay, so all right, sorry if that was not part of what we were supposed to be talking about now, but it was just something crossed my mind.
No, that's fine, perfectly fine. Anything else on this goal? Usually we will get a reminder from Emery telling us time to move to the next goal, but I don't think that's happening tonight. So we have to make sure we manage our time. And I think we're doing good so far. All right, so let's you all agree to move to the next goal? Okay.
Yes, that's fine.
All right, so this one is on community services, and the goal is to provide quality public services for citizens of all ages in all communities, regardless of income or ability. This one has fewer, I thought it has fewer actions now. So action number 1, implement free full day compulsory pre-kindergarten for children from disadvantaged households. Number 2, improve special education and alternative education standalone facilities as outlined in the My iPass report. Number 3, enhance existing collections and services of county library facilities to accommodate all users with remotely accessible services. Number 4, ensure libraries are future ready and equipped to remain current as demographics, the community, and needs change. Number 5, explore developing an equitable service area analysis tool for evaluating locations and program needs for community facilities in order to enhance accessibility for residents and increase levels of service as population change. Number 6, ensure that Baltimore County senior centers have the capacity, tools, and resources necessary to develop and implement programs that meet the current and future needs of diverse older adults. Number 7, provide flexible programs and opportunities in recreation centers by incorporating tools and resources that support a contactless experience. Number 8, improve the condition and programming at our recreation centers and parks in order to attract public use. Do you agree with the goal? Yes.
Yes, they're all maintenance goals. They're all goals that the county should already be working on. And I assume
Okay.
they are to some extent.
Okay.
Hi, my name's Marie. I actually have a question about the pre-K action
Mm-hmm.
that I wanted to explore a little more. So the idea is to implement free full day compulsory pre-K for kids from disadvantaged backgrounds. Right now we have free half day voluntary pre-K for kids that meet the county requirements as long as there's slots available. I am just so curious about compulsory and curious about disadvantaged households and how we're thinking about that.
So this is our vision for the next 10 years. We are hoping that by 2030 that this will be implemented. Like you said, right now it's half a day. I know myself had a kindergarten, that pre-kindergarten that went through that process where it's like, if spots are left, then, you have the availability. But in this case, we're trying to make sure that this is going to be a required thing where the priority will be those disadvantaged households to make sure that they do have full day pre-kindergarten implemented for them.
Gotcha. I mean, I got to be honest, like just me speaking, I think universal pre-K is what we should be shooting for across the county.
I agree with you.
Okay.
That would be, yeah, that would be ideal. We'll get there one day.
Okay.
Any other questions on any of the actions? Any actions you would like to add that you haven't seen listed here? Any feedback on any of the action?
Could you talk about number 5 a little bit, which talks about evaluating access? I think, again, it's impossible to do everything all over the county at one time. So to me, number 5, which talks about equitable access, trying to use some kind of analytical tools to try and evaluate various programs and decide which areas are in the worst shape in terms of services so that we can focus on targeting those. There are certainly going to be some parts of the county that are doing pretty well and have less needs. So I guess I'm very supportive of number 5 to try and target efforts.
Yeah, and this is, the effort by doing this is just to make sure that service again are distributed in a, using an equity lens. I'm just making sure that those areas that are lacking services or don't have that community facilities location. By using this tool, which is actually a ArcGIS tool, you are able to pinpoint from one location to find out what type of community facilities are around that location and what isn't around that location. And in that way, you can start filling the gap and, placing community facilities in locations that are needed.
Well, and I think that's very important because some communities are better at advocating. They'll turn out at the capital budget meetings and they'll lobby their council person. And usually it's the squeaky wheel that gets things. And a lot of the communities that may be greatest need may not know how to do that. So having the GIS analysis is a good way of making sure you're targeting resources where they most needed.
Great. So any other action feedback you want to add to this one, to this goal?
It's not so much, it's more of a question of priority. If you can't do all 8 things everywhere at once, 5 ought to happen first in order to try and prioritize where you target the other items.
And then if you were to prioritize them, which one are your, the items? What items are your, on top of your priorities in here?
I think that's hard to do only because different people in the community, if you're a senior, you're going to want senior facilities. If you've got kids that are preschool age, you want preschool. So I guess I think they're all very important goals, and my recommendation is to follow those goals, but to try and use number 5 to figure out where you target them and where you most need to, whether it may be senior services in some place and maybe preschool or library facilities or recreation in others.
Yeah, rather than give you a specific number, I would say prioritize those goals which provide skill sets that are useful to all ages to increase their well-being and probably earn money.
I'm wondering, this is Laura again from the health department, if we should have cultural competency or some sort of cultural terminology in this section when we're talking about services and access to services and equity. And it's referenced as populations change. I suppose you mean as populations change and our percentages of different ethnic groups change and the aging population changes. Is that what you mean in 5 probably?
All right, okay, on 5, yeah. So as population change, I mean, population can be age, can be race, can be ethnicity.
Okay.
So that's what I meant here.
Okay.
And I would argue that our best long-term return on investment would be in number 1, full-day compulsory pre-K for children from disadvantaged households. They have the longest time to benefit from that investment.
Okay, that's a great one. That will help us when we prioritize these goals.
So just looking at number 8, when we talk about improving the condition and programming at our rec centers and parks, and I'm sorry, I'm not sure if this is further up too, but like I would love to see that not just to attract public use, but to improve the health and well-being of our communities overall, and to really tie that in.
Okay.
This is Jennifer. I was just going to add in this has been my sort of message for all the meetings that we've done. I think anytime we really have to be careful when talking about prioritizations. I mean, this is really going to be based, as you indicated with the analysis, that community X, community Z, their priorities are, in any of these lists, their priorities are going to look different based on their needs, as y'all have stated with the population. So I don't know that it's fair to ask about prioritizations. Yes, these are all important goals, but this is going to look different in different parts of Baltimore County as far as what their priorities are. And I just think that's just something we have to recognize.
Right. So that's a good thought. With the master plan, we're just trying to have this type of goals and actions that will serve countywide. But I get what you mean with the different communities need and priority.
Thanks.
Sure. Anything else on this one, or would you like to move to the next one?
Let's move to the next one.
All right. And the next one is community recreation and parks. The goal, let me move this next page. So the goal is to provide and promote safe, equitable, and inclusive access to quality parks, green space, recreation facilities, and programs. Action number 1, establish a county-wide green network plan and program to provide better connectivity by linking and connecting parks, green spaces, and recreation areas for pedestrians and cyclists of all ages and abilities. Number 2, eliminate the inequitable access to public amenities and renovate and enhance all the parks to ensure that they meet modern recreational needs and are an asset to the communities and neighborhoods they serve. Number 3, set priorities and work to fill the gap in an inclusive way in historically underserved areas so that projects, programs, and resources are focused in these priority areas. Number 4, ensure that county residents who live inside the hurdle live within a 10-minute walk of a park or public open space. Number 5, improve outreach to engage residents in all communities to make them aware of parks and recreation opportunities and gain better insight on their recreational needs. Do you agree with the goal?
I agree with the goals. I think you should prioritize number 4 and also maybe add an action that says the county should really emphasize working with volunteers and permitting volunteer from the community, particularly community organizations, to help maintain the park. There's been a lot of resistance to that, and I think that needs to change because the county doesn't have the resources to do it all by themselves.
I think also that it's
Hello?
I don't see anything about playgrounds or safe areas for children to play. It would be wonderful if they would be available within a 10-minute walk. But I don't think they are right now. Is there some push to have some sort of easy transportation available until we get to that goal of having everybody be within a 10-minute walk of an open space or a playground? This would be for disabled people as well as seniors, as well as anybody who doesn't have a car, to just have it be easy and easily accessible and hopefully free. And the other thing is just to talk, to add to what was said before about involving the community with community gardens or cleanup or bird watching or whatever, to have the Baltimore County Public School, maybe the high school kids be involved in internships to actually have scheduled not just community service, but for their requirement, but also jobs to lead nature play activities for kids or bird walks or even doing cleanup and to save the bay. I think there's a lot of opportunity to get the kids involved and to teach them, to get them interested in science and to give them an opportunity to get the kind of experience that would last further on in their lives.
Okay. That's a good one. I wish my son could hear this one.
I had a comment on number 4, because I think that I agree that is a wonderful goal. I'm wondering if there's more ways to qualify it though, and I'll just give you an example. I live in an area where we can definitely access a park within 10 minutes, but to do so, that you have to cross some pretty gnarly busy streets that don't always have crosswalks that are convenient or might not have the connection of sidewalks that makes it friendly for families with small children or if you're using a wheelchair or anything like that. And so I'm just wondering if we might think about some sort of access language when we think about what a 10-minute walk means, and what that walk looks like for folks.
All right, so you're saying that, for the ones that already have that 10-minute walk, that to also make sure that it's accessible to parks, that it's connected to parks. So not only the 10 minutes, but also make sure it's accessible and walkable.
Yes. Yep.
Okay.
That also ties into Action 1, and is actually something that is on the county's radar right now, between Department of Recreation and Parks, Department of Public Works and Transportation, and some other agencies that are involved in improving bicycle and pedestrian connectivity.
Great.
Thank
That's
you,
wonderful.
Pat.
I really agree with that. I support number one. I think that there are places where a trail could be created. It's floodplain, it can't be built upon, and it takes time to build these trails up. If you could use some citizen volunteers, that might be a way of getting it created sooner. But being able to protect those green spaces is important, and the GIS mapping of where green networks exist or could be created is something I'd like to see done as part of this.
Yeah. Yeah.
I would add that, this kind of ties into community safety. The family parks are not, they open from sunrise to sunset. And after sunset, they are known to become used for other purposes, maybe creating families, maybe, alternate meeting places that are kind of out of the way. I mean, I think it would contribute to community safety if the community parks had a way of being locked off after sunset.
Okay, that's a great one. Yeah, that's something that we usually don't think of, but yeah, after sunset, I mean, the kids are gone. Those places are being used for something else.
Correct. And that's pretty well documented in my district, District 4.
Yeah, I know so.
This is Jennifer. I think I would add this to the it's the third item that you added there where it starts with Baltimore Public Schools. If you just want to add, no, not the third item, but the added text here.
The added text.
Scroll down. Okay, you see where it starts, Baltimore County Public and High Schools
Yeah.
be involved.
Yeah.
So with that one, I think adding because there are parks around here, but there's very few that have like an education. And I've not been in this area for a long time. I mean, I know Roland Park has that education center, but the parks like in this area, there's no interactivity with park rangers or education services, things like that to allow for that. So I guess I don't know, hiring park educational staff or rangers or something to that it's just there's something to educate or someone to educate.
Okay. In the parks.
Right. I mean, if we're talking about why am I going to again, there's an assumption that everybody wants the same thing at every park, and that may not be the case. And so you have to, other than people just walking around using it for parties and things like that, if there's a desired activity to be had at these parks, it would help. It would serve a purpose to have people there to help people engage in whatever we're trying to do.
All right, like a STEAM center.
Right.
Okay. All right. Okay. Anything else?
Important to have facilities there, restroom facilities, even if it's not a building, to have something that's not so distasteful, gross, or as the porta potties, you know, certainly have their uses and
I agree with that fully.
Oh, I didn't hear anything of what you said. I think I lost you.
oh, can you hear me now?
I can hear you,
Good.
yes.
Okay. I'm just saying that in parks, there would have to be restroom facilities. Even if there wasn't a built building, you know, that would have, you know, brick building, even if it was porta potties, it would be important to have the restroom facilities, even if they're porta potties, be large enough, you know, for disabled people, or to have two people be able to go in there if there's a care.
Okay.
And I would say that I agree with that fully. That's currently a problem at a number of the county-owned recreation areas, that there's no appropriate place, and it results in some unpleasantness near the homes.
So I see some people coming back. Is it the end of the exercise, or you guys just finished early?
We finished early.
Oh, okay, good. All right.
We'll be quiet as a mouse.
That's fine. You can join in the discussion.
Thank you.
You're welcome. All right. So, I mean, we got some very useful feedback. Is there anything else you want to go back to, another goal, action? Do you want to wait for the rest if you are done with feedback?
This is Jennifer. Is there a place, or even if it's in some of the other topics, where we discuss financial management education for youth, whether starting in like junior high and above?
Okay. So that could be tied with the education. Which one is that one?
I think it was it 1 or 2? I feel like. I think it's above there somewhere.
Community services. Okay. Well, we talked about
or even under the crime one, yeah. But
Yeah.
something just to, and it could be under crime, but anything just to kind of, you know, whether it's both college and financial management, just, you know, that should be started fairly early.
Mm-hmm. Okay.
As an example, my now this was back in Texas. My husband got a Wells Fargo bank, went into their schools in kindergarten and set everybody up with a junior savings account. So, and did a financial education class.
Okay. Yeah, the better you start, you know, the better you will be at saving later on in your adult life. The earlier you start. All right, so any other, do you want to go back? Do you want to review again the first goals? Do you think that you got it all? You can always, you know, if you missed or you forget to provide any feedback, you can always send it to the master plan email. We also have a survey online talking about the same actions and goals. You can take it, it will be up for a week. Or if you know anybody who wanted to attend but couldn't, please let them know it's available. It's online. It's on the master plan online website. So this is an ongoing process. If you know remember anything, don't hesitate to send us email. All right. Well, it was nice working with you guys. I'm just gonna clean up my my writing here a little bit, and then we're gonna wait for everybody to come back, and we'll start recording. I'm gonna stop sharing my screen at this time. Thank you.
to market our own stuff, especially meats, I would say.
Good night. Everyone is back to the main lobby.
I was not, I was muted. So I was saying thank you and welcome back. Amy is the first group to report on their on what they heard. Amy, are you ready?
I am. Pull up my screen. Right. I can enlarge it a little bit so everybody can see it. Okay.
Yep.
All right. So for the first goal, under community health, attain full health and well-being for all ages and communities by eliminating health disparities and promoting healthy development and behaviors. We only had 2 comments. There were questions or comments about the need for specific measures or metrics to measure the items. And I did talk a little bit about our intention to have that as part of the second part of the master plan with an implementation plan, that there would be metrics to measure all of these elements or all these actions so we can track them over the next 10 years. There was a question about number 9, specifically, how can we encourage that? And there was a note to maybe look into also including race equity concordance in the healthcare service. For community safety, using a multi-agency approach, foster safe and stable communities. The comments were first related to number 3, include a job opportunities program that parallels the re-entry into the community. Look at the ratio of police officers to residents, especially in growing areas. Look at an alternative option to police force for crisis intervention, possibly focused on social workers, mental health workers. Ensure that there's use of body cameras for all police officers. Also, look at alternatives in schools to police safety or to safety officers in schools that are social workers or mental health workers. Specifically for number 4, related to the Vision Zero strategy, the need for a crosswalk at Delaney Valley and Seminary due to pedestrians accessing the trail there. And look at adding bike lanes to roads that are wide or wide enough to accommodate them, and specifically noted was Pot Spring Road. And also accessibility issues for residents with disabilities along Bel Air Road, with things such as issues such as power poles in the middle of sidewalk. And those issues looked at there, but also countywide. For community services, provide quality community services for all citizens of all ages and all communities, regardless of income or ability. The comments were availability of devices from libraries so that you can check them out and use them for access to Wi-Fi. Expansion of access to Wi-Fi in the parking lot of libraries. Expanding the program for social workers in libraries throughout the county. Expansion of the van service that provides legal services at libraries throughout the county. And specific to number 8, look at infrastructure improvements in parks, lightings, benches, and accessible areas. For community recreation and parks, provide and promote safe, equitable, and inclusive access to quality parks, green space, recreation facilities, and programs. There was a comment related to number 4. They were very supportive of the idea of having a park within a 10-minute walk of your community if you live inside the URDL. Connecting number 1 and number 3, better bike and ped connections to smaller parks and community parks, especially in underserved communities. There was interest in, related to number 3, making the Freedom Trail that's been proposed in East Towson a priority. And to make sure there's continued collaboration countywide with Recreation and Parks as they're developing their master plan, and in coordination with our master plan 2030. And that was it from my group.
Thank you, Amy. Next is David.
All right. put up my shared screen. Really quickly, thank you to everyone who was in my group. I thought we had a really nice conversation. I'm just going to highlight a few good things I thought we talked about, even though I thought most of it was really great. So with this goal of our natural environment, we talked a lot about different types of building that might be possible. And one thing we did actually mention was considering things beyond solar and wind when moving past that, including eco villages, which are communities specifically dedicated and planned to be in harmony with nature. And we should find opportunities to create these. Moving right along. In addition to some of the public health education, they wanted to highlight, especially considering the changes in this since 2010, anti-vaping and artificial cigarette education should be expanded as well. Moving along. We were talking about homelessness, and one thing that got brought up was really a consideration of veterans receiving housing support as a priority for all these initiatives. Two big topics we had are potential additions, both of which we thought were really great. Considerations of family support for public health strategies as a big part. The local government doesn't need to be responsible for everything. And then we really like this idea of creating a larger local health food security initiative so that great local food can get into schools, hospitals, other community groups. We should be finding more ways to help local farmers put their food into local hands, and incentives might be the best strategy for something like that. But it's also going to be important to remove some of the procedural barriers like approvals and permits. So going along here, we were talking a lot. We had talked about skills training in, at a previous during a previous master plan session. So we thought if you have a nonviolent offender incarcerated, then perhaps skills training at a local college might be one of your best strategies. And then it's really, you're already supporting this skills education. Why not just let the offenders attend those during the daytime hours? Moving along. We had some people with experience with the fire department on our conversation tonight, and they're having trouble training folks properly within the county, be without the Towson Training Center that was recently changed up. So this might be a good plan. And then this, of course, applies to number 6 as well. Okay. Moving along. Sorry, I skipped a few there, but I had a couple more highlighted down here. We also want to make sure that we're highlighting the public amenities that are in really great shape. We have a lot of really nice parks, and we should make sure that people know about them. But one thing that's I think a lot of people know is that taking down some of the basketball nets to address violence, and we should consider this has been going on for some time as a public policy strategy. Is this really still working as the best strategy, or is this just making people who can no longer play basketball suffer? So again, I think that's all I've got. Really, thank you to our group. Great conversation, and I hope I conveyed everything that we've talked about well.
Thank you, David. Mark, you next.
Alrighty. Go ahead and share my group's work. They did a very great job, and thanks for their participation as always. So just going right into number 1, generally with all the goals, everyone agrees with them. They agree that they're all pretty generalized, but overall they agree with all the goals. For the first action item, better ways to incorporate the CMDP, the Comprehensive Manual of Development Policies, to integrate with the master plan. They see the master plan as kind of the guidepost, and then the CMDP as the implementation tool. Moving on to number 3, kind of into the Crisis Stabilization Center work would also be to include crisis stabilization in part of the dispatch work. So how we have social workers instead of police officers for certain situations be first responders. Number 5, and this was kind of a point that was brought up in many of the action items, most of them, was why was there a metric incorporated in this one and not the others? So maybe we can try to have metrics included. I know Amy mentioned that we will be including metrics within the master plan. So that's just a observation. And then also, how was the 60% determined? So that's pretty much it for those initial thoughts. Other thoughts about these action items in goal number 1. Continuing to build onto library resources for mental health services, social services, and that means retrofitting libraries that weren't designed for these services. So how can we include maybe private meeting pods or rooms, et cetera, into the libraries? Funding it was brought up, how we're going to pay for all of this. So reasonable concern and question. So how we're going to be using funding mechanisms to kind of work these services out. And overall, I think a lot of these items are individual behaviors. So the county has only so much control over, how people lead a healthy lifestyle. So continuing to promote and educate is helpful, but no guarantee on individual behaviors over the next decade at least. All right, moving on to number 2. One question: how do we define address public safety? Is public safety meaning lack of public safety or positive public safety? So a little more clarity on that was needed. Some thoughts on number 2 for the for gangs specifically and youth. So a quote was brought up: idle mind is a devil's workshop. So one great initiative would be to identify communities that are cultural and recreational deserts, where there's really not much opportunity for youth. And once we identify those areas, then we build on community, cultural, recreational opportunities for youth. Also incorporated with inmate resources should be job training and workforce development. And let's see, so modernizing police and fire, not just facilities, but if we're including services, we should incorporate more community engagement and outreach through the police department to kind of reduce negative feelings towards police officers when police officers may come to just negative types of events. So instead, we should have police just more involved, even though they are, but just continue to build on that. And family intersections should be a priority for this section. And again, metrics and timetables should be incorporated under each action item. All right, under number 3, community services. Question was brought up: how do we define disadvantaged households? So something we shouldn't be vague about. So just incorporate in the master plan how we're defining that. Phase contactless. This the wording of this section brought up some questions: why we're saying contactless experience, and it might not be necessary to incorporate that. We understand kind of the idea behind it, maybe with COVID and everything, but overall, just evaluate how people can access all community facilities in general. And lastly, community recreation and parks. Not many thoughts on this. Overall, we agree with all the items. Just under number 4, how are we determining what public space is? Are schools and school fields considered public space? And we should just continue to leverage already owned properties that the county owns. And then an interesting point was brought up for a strategy that the county can incorporate for inventorying potential parkland and then come up with a first right of refusal for those properties. So if the county can have kind of a first access to those sites with agreement with the owner and before it goes for sale at the open market. And then also just continuing waterways. Waterways should be incorporated in this section as well, not just parks. So, and that's all for my group. Thank you.
Thank you, Mark.
Okay, thanks.
Taylor's up next.
Yes, thank you. Yeah, so as everyone else has said, I want to thank my group. They offered a lot of very valuable feedback. So as far as community health, some of the ideas that we came up with were to expand free meals to more or all schools, encourage farmers markets. Our group seemed to really love the idea of mental health treatment being more accessible and normalizing that. We did have a question of how these things will be implemented. Will things like zoning be disregarded if something like a food store is needed? And then we also had the idea of subsidizing food deliveries, such as like Instacart. If residents are living in a food desert, the county could work with deliveries and grocery stores to fix issues like that.
Taylor,
Moving on to,
excuse me, can you make a screen bigger?
sure, sorry, I just had them on one page and then the other. Moving on to community services, we liked the idea of pre-K starting with disadvantaged households, but would like that to be spread to be universal, with the idea that income should not determine if you have access to your local school's pre-kindergarten. We also talked about loving our libraries, but would liking to see additional like napping facilities or showering facilities so that more people and more residents could take advantage of those, and having more multi-purpose facilities, however, understanding that not every space is going to be perfect for every use. And then we also had a pretty robust conversation about planning for when a structure will be finished. So using demographic analysis for what will be there in 5 years when a facility is finished, not what exists right now, and overestimating the county and a community's needs. Assume that if a new school is being built, new families will move in, but things like that people will want to use what's new. So kind of overestimating what we're planning for. Moving on to recreation and parks. I think I skipped public safety. I'm sorry. Yes, sorry. As far as public safety, a lot of the ideas that Mark's group brought up, especially allowing incarcerated folks to better themselves, teach them skills while they're there. And then we had the idea of removing the veil between law enforcement and the community, having a 311 program that's more widely used, having communities have better relationships with their law enforcement officers and community liaisons. And then Councilman Jones's legislation about security cameras was also brought up, and having Baltimore County Police Department being able to kind of tap into those so that it speeds up response times when a crime is committed in order to make the police department's response more effective. And then finally, moving back down again to recreation and parks, the big thing that was brought up was better connectivity and then promoting Baltimore County's natural areas, emphasizing what is there now, what you can do there, how you get there, what it can be used for. We all acknowledge that recreation and parks is doing as much as they can given their current situation, but giving more resources to recreation and parks to promote and execute the things that need to be done. We had a lot of other thoughts and comments, but those are really the highlights. And yeah, thank you.
Thank you, Taylor. Brett?
Sorry, I was muted. I'm here. Give me a second to pull up. Okay, hopefully everyone can see my screen. We had a great discussion this evening. Hopefully I'm able to convey all the great thoughts that were discussed in our group. So for the first one, community health, we agreed with the efforts to push for push to fight the efforts of homelessness and mental health, getting better support efforts and doing a better job with outreach. Also, coordinating and partnering with the health department's Bureau of Substance Abuse, to get them involved with efforts to reduce and uh, reduce the use and of drugs and alcohol. Also, I thought this was a good one. Medical checkups, like in-home visits for seniors who are aging in place and staying at home. Um, we also talked about the support for reduction of food deserts and providing access to fresh, healthy food for all ages. Also, opportunities for kids to walk and bike to school safely, and providing more trails. And also having for 911 social worker options, persons who will be available to assist when 911 gets calls, to assist with mental illnesses and help provide like coping mechanisms, and just being able to educate the 911 staff on mental illnesses in general. For community safety, investigate legislation that denies resources and programs to incarcerated persons, and help assist in rehabilitation. So we felt like the incarcerated people were at a major disadvantage as far as getting assistance from government programs and such as food stamps and things of that nature to help rehabilitate them and get them back on the right track. We wanted to see more recreational and PAL centers for the youth, more trainings for law enforcement to dealing with mental health and de-escalation training. Um, and also, we thought the Vision Zero strategy was a great idea, but wanted to see it expounded more on and the plan become more robust and have more actions that would ensure pedestrian safety. Um, there was an idea to partner with the Dutch Cycling Embassy, which is in the Netherlands. But we felt there are so many countries out here that are successful in grid networks and patterns and for cyclists and pedestrians, um, that the county could possibly expand outside counties or cities. Um, so that was pretty good. For the next one, county services. We thought the pre-K availability for pre-K to disadvantaged youth. I'm sorry, dis disadvantaged households was a good idea. Well, we thought maybe to investigate that option versus affordable childcare, um, or different alternatives such as funding for one parent to stay home or incentives of some sort to help with those efforts. Um, Also, we talked about affordable meeting spaces and facilities. Um, just having places such as libraries, churches, um, where the meeting spaces are more affordable for maybe groups who uh, don't aren't as financially stable as others. Um, Excuse me. We also talked about access to free internet for students and adults who telework and virtually learn. And the last one, community recreation and parks. We discussed a bunch of trails that could possibly be connected. Sorry, a bunch of trails that could possibly be connected. The NCR Trail, Jones Falls Trail, the Ma and Pa Trail in Hartford. Maybe doing doing trails that could um, uh, partnering with different counties such as Hartford. Um, and also the reduction of development um, to achieve more green space, open space, and parks by reclaiming older, wore down, and abandoned properties. Um, and we also had a couple more parks, such as the BWI Trail, Jones Falls Trail, Patastico State Park, Loch Raven, um, and basically just keeping the partnerships alive to build and maintain parks throughout the county. And that's all we had.
Very good. Thank you, Brett. All right, so now I will be sharing my screen.
There's still Chris.
Oh, I'm so excited to report back. Chris.
Did you almost forget about me?
No, I will never do that. Please go ahead.
All right. Okay. Is the size okay? All right. Under community health, my group wanted to kind of put a finer point on the suicide prevention plan. In addition to focusing on youth, they also wanted to take into account at-risk populations, and because at-risk populations need help too. Or under number 7, reducing food deserts, we proposed more increased community gardens, healthy eating education. The Maryland Food Bank, for example, offers recipes for healthy meals for people that receive their services. And under the quality and quantity of healthcare options in underserved areas, my group wanted to address the unconscious bias in the healthcare system so that people of color receive the same care as others, not just separating out access to healthcare specifically, sort of focusing on how different cultural groups are treated and that they're treated equally. You need to come up with indicators to measure improvements in that situation as well. Provide training to improve the treatment of those in those groups, like role playing, for example, for healthcare workers to improve their awareness of the situation. Another goal or another action we would like to add to this goal would be to promote physical activity in itself as a pathway toward better health for people. We weren't quite sure where to put this, but the goal itself of using a multi-agency approach to foster safe communities and address public safety, there was a concern that higher income communities get a better response from public safety officials. So we need to address that as well. For reducing criminal activity and violent and organized crime, it'd be a good idea to have police, fire, teachers, et cetera, to provide sort of positive activities for youth during breaks from school. Not necessarily just in the summer, but anytime there's a break before or, after school, spring breaks, things like that. And expand after school programs that teach things like sports and robotics. I think the MOST program was mentioned. I'm not familiar with that one, but one of my group members mentioned that one. Also to sort of intervene in gang activities. They specifically mentioned addressing bullying, which sort of fits under that. And one of my group members mentioned having gone to a Baltimore County Police information session at one of the local schools, where they basically just kind of educated people about gang activity in the community, just so sort of increasing awareness of the problem itself. For decreasing recidivism in juveniles and adults, I'm not sure what happened with that first sentence there. I'm sure I was going somewhere with that. But for those who are incarcerated, it'd be a good idea to focus on education while they're there, and then programs for when they are released from prison to kind of ease back into society. And there are plenty of nonprofits and groups that can help with that. It's also a good idea to make prison safer for inmates. You know, it's one thing you do something to get in there, but once you're in there, you're also in a dangerous position too. With the Vision Zero strategy for addressing safer streets, our group suggested that we redesign the infrastructure on roadways to get away from auto-centric designs, sort of the complete streets approach. And also, they're just not even for pedestrians and cyclists, but also for drivers. There's plenty of bad drivers out there, disregard for traffic laws in general. So, people in cars are at risk as well. As part of going back to the complete streets, use efforts like traffic calming, bump out, cycle tracks to sort of make it safer for pedestrians and bicycles. Share the road doesn't really cut it. They also suggested adding another action, which would be to improve police response to citizen calls, sort of make sure that when a citizen calls the police with an issue, that the police sort of closes the loop on that case and, follows up and doesn't just sort of drop it and the citizen never hears from them again. For community services, with the pre-kindergarten for children from disadvantaged households, I guess there was a question of, does it necessarily need to be compulsory or sort of an opt-in for those that could use it? There is the general thought that children from the disadvantaged households, they tend to start behind other children, but there needs to be a choice as to whether parents want to take part in that program. It needs to respect the rights of parents, maybe by offering subsidies for daycare for those parents to sort of make their own decisions about daycare. But also not just for disadvantaged households. I mean, plenty of middle class households with both parents working still have trouble paying for daycare. Under special education, one of my group members just wanted to make the point that many kids can't get the help that they need because they don't necessarily fit the requirements for the specific special ed programs. So I guess there needs to be more alternatives for those kids that sort of kind of fall between the cracks. Again, we tried to add another action here. And in general, there needs to be better communication about government town hall meetings for citizens to often offer public input, such as like email lists, things like that, just because citizens really sometimes don't realize all the public forums that are out there. And finally, under the goal of Parks and Recreation, my group was very, very happy and could not agree with more that we need a green network plan to better connect to surrounding parks, green spaces, and recreational areas for pedestrians and cyclists. They specifically mentioned that we need better connectivity between jurisdictions, city and surrounding counties. For example, connecting the NCR Trail to the Jones Falls Trail in the city. Another example that was brought up was that with Baltimore City Public Works owning the reservoir lands, it'd be good to get them to work more with Baltimore County to improve reservoir lands and sort of adopt a stewardship model that includes citizen volunteers to sort of fix up sort of degrading trails and recreational activities there in the reservoir properties that the county really has no control over. It used to be that you could ride your mountain bikes there, or mountain bikes within the reservoirs, but they don't allow that now. And there's a lot of missed opportunities there. There was a thought that a task force could be developed to sort of visit and evaluate the needs within each community of parks, but also other public amenities, and sort of make sure that everyone is being served. And finally, we added 2 more actions because that's what we do. They wanted to improve accessibility to parks and public facilities, especially for those who do not have a car. And also to give the Baltimore County Pedestrian and Bicycle Advisory Committee more teeth and influence. And I believe that's all we have.
Thank you, Chris. All right, I believe I'm next now. Okay. Everybody can see this? So goal number 1 is for community health, attain full health and well-being for all ages and communities by eliminating health disparities and promoting health development and behavior. So my group generally agree with all the goals. So this one, they agreed with this one. You know, they said that this is a mom and apple pie. So how can they disagree? They think that all the actions seem to be very important. They said that the mental health is needed. Food desert is an issue. So we just want to make sure that the underserved areas have space to grow their own food and are given the resources needed to grow those food. They also think that the number 10 might be the most important action under this goal. There is a big issue for access to healthcare. So what type of ways, you know, are we putting together to access health facilities? No, usually they cannot afford the service once they get there. So we should have some type of program in the county to help with this issue of affordable healthcare. There were also some questions about underserved areas, and I was, you know, glad to have Laura Culberson in my group, and she was able to explain the underserved areas. That it means that there are no doctors in those areas, so it's lacking medical facilities in those areas. The aging in place, they thought is an important action. So the county need to focus in making sure that we can maintain those existing homes and get them ready to age in place. And there were also a comment about trying to collaborate with existing healthcare management programs, such as the diabetes management or blood pressure management programs, which is similar to what the Veterans Move program is already doing. Environmental health, we touch base on that. They would like to see some type of open spaces, green spaces, air quality, you know, places to be with clean air and facilities for exercise. So the next goal is for community safety, using a multi-agency approach, foster safe and stable communities, and address public safety issues that affect all residents. They agree to the goal and generally agree to all the action. They think that these are maintenance actions that it should have already been going on anyway. They would like to find more accessible free training programs and employment opportunities for technical jobs. To help with the what was the idea on this one? It was to help with criminal activities. And they said that there's never enough resources and we need to start prioritizing these actions into short, medium, and long term. For number 7, they said that we need to add improve police force recruitment and retention to increase the number of active duty officers that we need to also add to that action, fire department and EMS. So number 3, the number 3 action, they would like the county to spell out what type of resources will be provided for the recidivism after they get out, the recidivism in juveniles. Educations toward juveniles, they think that we should start doing this type of education before and not after they are actually in trouble. And also housing programs and job provisions should be put in place for the released people after incarceration, because the punishment should end after incarceration and we should be able to help them fit better in the community. And there were also some discussion that many of these goals cross over and are overlapping between different meetings that this individual has attended. Community services, the goal is to provide quality public services for citizens of all ages in all communities, regardless of income or ability. They agree to the goal. Some feedbacks on the action, again, they said these are also maintenance goals and actions. They will talk about how to prioritize the goal, which provide, when we prioritize the goals, we should go with goals that provide skill set that are useful to all ages and that can improve well-being. On the number 5 goal, explore developing an equitable service area analysis tool. They agree to this one, and they say that this tool will help define and identify places that are lacking community services. They also thought that the number 1 action might be the best return investment for this goal, implementing the free full day compulsory pre-kindergarten for all children from disadvantaged households. Number 8, action number 8, they said that we also need to add that it will also improve the well-being of the entire community. So action number 8 is improve the condition and programming at our recreation center and parks in order to attract public use and improve the well-being of the entire community. So they would like to add that at the end of the sentence. And also some type of financial management program for the youth, to let them to start getting educated early. Example, junior saving account. It can help with criminal activity. So the goal on the community recreation and parks is to provide and promote safe, equitable, and inclusive access to quality parks, green space, recreation facilities, and programs. They agree to the goal, and they also agree mostly to all the actions supporting the goal. They think that number 1 and number 4, action number 1, which is the countywide green network plan, the better connectivity approach, should be connected to number 4. And number 4 is living within 10 minutes of a park or public open space. So in other words, let's not only live within 10 minutes of a park, but also let's make sure that that park is accessible and it's connected. And we should also emphasize working with volunteers to help maintain the parks. Somebody brought the idea that the county doesn't have the resources to do it all by itself. but if we put together some type of programs where volunteers can help maintain the park, it would be good. And there were also an action added to also include playgrounds within 10-minute walk, not just parks, but make sure that those parks also have the playground amenity. And then there was a comment about whether before, while we're working on that goal, will there be easy transportation available for that 10-minute walk of a park? Will there be some type of transportation access to the park until we get to the goal of the 10-minute park? There were some recommendations to have Baltimore County Public Schools, especially high schools, to be involved in internship for community services or jobs, to lead nature play activities, like clean up, save the bay, and just to teach them to be interested in science, which is a lifetime experience. So they said that the parks usually don't have no interaction with education services, and we should help put those programs together to just help people engage better. So this one is also a good one, community safety. It's related to community safety because our parks usually are open from sunrise to sunset. But after sunset, there's other, criminal activities going on. So we just want to make sure that after sunset, we lock off those parks. And for the temporary restrooms, those portable toilets, they want to make sure that they are large enough in the parks for disabled people or for more people or for access for more than one person. And this has been an existing issue. All right, and that's all I have. Here, I want to thank everybody for providing your feedback. And I will turn it on to Amy, who's going to wrap it up now.
All right. So I just wanted to remind everyone that we do have 2 more meetings left. There's one next Monday focused on interwoven equity. And then the last meeting will be the following Monday, February 7th, for Harmony with Nature. If you haven't already, be sure to go to the master plan website. It's baltimorecountymd.gov/masterplan2030. And I think the link's been put in the chat a few times. Once you go there, if you go to the Healthy Community tab, there is an online survey if you want to give us some additional feedback about the goals and actions. The goals and actions themselves are posted if you want to go back and read them. We'll post this meeting recording and the slide deck, and as soon as we can get all of the input from all the different breakout rooms compiled, we'll post that as well. So I just want to thank everyone for joining us again tonight for another one of these meetings, and we look forward to seeing you next week.
Is Nancy even here?
I don't know. She was here earlier. There she is. She's gone.
She's gone now.
All right. So
Oh,
we made it through another one. Does anybody have anything that